Good afternoon, class. So today we will discuss chapter 13, blood vessels and the circulation. So, tapos na tayo sa blood and heart. So, ngayon naman, i-discuss naman natin yung vessels and how it circulates to the body. Okay, so what are the functions of the circulatory system? So, it carries blood, basically. So, and also it exchanges the nutrients, the waste, and the gases within the tissues, transport the substances, help regulate the blood pressure, and directs blood flow to the tissues. So there are three types of blood vessels. So we have the arteries, or the one that carries oxygen-rich blood away from the heart to the tissues. Then it can be elastic, muscular, or it can be through arterioles or the smaller types of arteries. So next we have the capillaries, exchange between blood and tissue fluid. So they are thinner than the arteries and has lower blood flow. And we have the veins, and so they carry oxygen for blood to the heart, thinner than the arteries and less elastic, and has fewer smooth muscles. Veins increase in diameter and thickness while decrease in number as they progress toward the heart. So the venules, small veins, medium veins, or the large veins are the examples of veins. And so our artery, veins, and capillaries are composed of different kinds of layers. So for arteries, uh, we have the tunica intima, tunica media, and tunica adventitia. So the tunica adventitia is the outermost layer, while the tunica intima is the innermost layer. Then the artery has elastic layer or elastic tissue that can be separated into two, the internal and the external elastic lamina. And it is also composed of smooth muscle, or this is the tunica media. Then for our vein, it doesn't have the elastic lamina, but it has an endothelium and adventitia, same with artery. Then for our capillaries, it contains endothelium, basal lamina, and it is smaller. So the branches of arterioles and the venules uh, makes the capillaries. Yan. So, general features of the blood vessel structure. So, besides venules and capillaries, blood vessel wall consists of three tunics or layers. Like what I've said, the tunica intima, tunica media, and the tunica adventitia. So, the tunica intima is composed of simple squamous endothelium, while our tunica media is composed of smooth muscle with elastic and collagen tissue, and tunica adventitia is composed of connective tissue. Yan. So this is the tunica externa, tunica media, and the tunica intima. So if you could see, the tunica media is thicker than the tunica externa and the tunica intima because it is composed of smooth muscle. And this is the external elastic lamina or membrane, while this is the internal elastic membrane. So what are arteries? So there are different types of arteries. We have the elastic, muscular, and distributing arteries. So the elastic arteries are largest in diameter and has the thickest wall. So example are the aorta and the pulmonary trunk, while our muscular arteries are medium to small size and thick in diameter, and our distributing arteries are our medium-sized arteries. So the smooth muscle tissue enables these vessels to control blood flow to different body regions. So there are two ways: vasoconstriction and a vasodilation. So when we say vasoconstriction, it means contraction of the smooth muscle. So lumiliit. So decreases blood vessel diameter and blood flow, while vasodilation widens or relaxation of the smooth muscle and thus increases blood vessel diameter and blood flow. So it contains smooth muscle cells and control blood flow to body regions. Yan. While our arterioles transport blood from small arteries to capillaries, they are the smallest arteries in which the three tunics can be identified. And the tunica media consists of only one or two layers of circular smooth muscle cells. Then we have the capillaries that is composed of simple squamous endothelium. Blood flows from the arterioles to the capillaries. So through the precapillary sphincters. So they are smooth muscle cells that regulate blood flow through capillaries. And the RBC flows mostly in the capillaries in single file and are frequently folded as they pass through smaller capillaries. So while the RBC passes through, the blood gives up oxygen and nutrients to the tissue, freezes, and takes up carbon dioxide and other byproducts of metabolism. Capillary networks are more abundant in the lungs and highly metabolic tissues like the liver, kidneys, and skeletal cardiac muscle than other tissue types. So the veins, yan. So blood flows from capillaries into venules to small veins. So the venules are slightly larger diameter than those of capillaries and composed of endothelium resting on connective tissue, while small veins are slightly larger diameter than those of venules. So the medium-sized veins collect blood from small veins and deliver it to the large veins. And the most predominant layer is the tunica adventitia, or the outermost layer, because it is composed of dense collagen fibers. So the veins are more distensible than the arteries. So large veins have valves which allow one-way flow. So hindi po pwedeng mag-backflow ang ating veins. So dire-diretso lang siya. So the folds in the tunica intima forms the flaps, and there are more valves in the veins of the lower limbs than the upper limbs, and must compete or counteract with effects of the gravity. Yan. So what are the blood vessels of pulmonary circulation? So when we say pulmonary circulation, this involves the heart and the lungs. So system of blood vessels that carry blood from the right ventricle of the heart to the lungs and back to the left atrium of the heart. So the blood from the right ventricle is pumped into the pulmonary trunk, and this pulmonary trunk branches into right and left pulmonary arteries, and that extends to the right and left lung. So they carry the oxygen for blood to the pulmonary capillaries in the lungs, where the blood takes up oxygen and releases carbon dioxide. And this oxygen-rich blood flows from the lungs to left atrium via four pulmonary veins, which the two are can be found in the lungs. Ayan. So blood vessels of systemic circulation. So when we say systemic, so carrying of blood through to the system, body system. So system of blood vessels that carry blood from left ventricle of the heart to the body tissues and back to the right atrium. So the oxygen-rich blood from the pulmonary veins passes into the left atrium to the left ventricle and then into the aorta. So, laging tatandaan yung nag-iisang vein that carries oxygen-rich blood is the pulmonary vein. So, arteries distribute blood from aorta to all portions of the body. Our aorta is a large elastic artery that is main trunk of the systemic arterial system. So it is the one that carries blood from the left ventricle of the heart and passes through the thorax and our abdomen. So the aorta has two branches. We have the ascending aorta and the aortic arch. So ascending aorta passes superiorly from the left ventricle. So the left and right coronary arteries arise from the base of the ascending aorta and supply blood to the heart, while aortic arch, the brachiocephalic artery, the left common carotid artery, and the left subclavian artery originate here and carry blood to the head and the upper limbs. Then lastly, we have the descending aorta, which is the longest part of the aorta. It has two parts, the thoracic aorta and the abdominal aorta. So the thoracic extends to the thorax to the diaphragm, while the abdominal extends from the diaphragm until divided into common iliac arteries. Then we have this kind of disease, the arterial aneurysm. It is the localized dilation of artery developing in response to trauma. So the rupture of large aneurysm in aorta is fatal. So kapag pumutok po yung aorta, yan, it can be fatal and it can cause death if hindi po agad naoperahan yung ating patient. Yan. So the blue side carries oxygen poor, so it is carbon dioxide rich blood, while the other side, the right side, contains the oxygen rich blood. So if you can see the blood flows from the vena cava, then enters the right atrium, then right ventricle, then goes to the pulmonary arteries, then flows to the lungs. And while in the other side, so the blood flows from the aorta and the branches and to the left atrium, then to the left ventricle, going to pulmonary veins and flows to the capillary bed of lungs where gas exchange occurs. Then for our systemic circuit, um, systemic veins are involved in the other side, and while the systemic arteries in the right side. So we have the blood vessels of the systemic circulation. So the arteries of the head and neck are the brachiocephalic artery, which is not present on the left side of the body, and it supplies the arm and the head. Then on the left side of the body, we have the left common carotid artery and the left subclavian artery. So these two, the common carotid arteries branch into internal carotid arteries and external carotid arteries. Then we also have the vertebral arteries that branch from subclavian arteries and supply blood to brain, spinal cord, vertebra, muscles, and the neck. Then it comes together and unite to form a single basilar artery that supplies the pons, cerebellum, and our midbrain. Then we have arteries of the upper limbs. So the subclavian artery becomes the axillary artery in the armpit. So this artery becomes the brachial artery in the arm, wherein we measure our blood pressure. So the brachial artery branches to form the ulnar artery and the radial artery. Then we also have the thoracic aorta and its branches. So we have visceral arteries, parietal arteries, and that can be divided into posterior intercostal arteries and superior phrenic arteries. Then we have the abdominal aorta and its branches. So the visceral arteries has paired and unpaired visceral branches. So for our three unpaired visceral branches, we have the celiac trunk that supplies the stomach, pancreas, spleen, upper duodenum, and the liver. And the superior mesenteric artery that supplies blood in the small intestine and the upper portion of the large intestine, and the inferior mesenteric artery that supplies blood in the colon. Then we have three paired visceral branches. So we have two renal arteries that supplies blood in the kidneys. We have two suprarenal arteries that supplies the adrenal glands. Then two visceral branches of testicular arteries and two ovarian arteries. Then our parietal arteries can be divided into three. The inferior phrenic arteries that supplies the diaphragm, the lumbar arteries that supplies blood in the lumbar vertebra and the back muscles, and the median sacral artery that supplies in the inferior vertebra. Yeah. Then we also have the arteries of the pelvis. So we have the common iliac arteries, and they divide to form the external iliac artery and the internal iliac artery. This internal iliac artery can also branch more into smaller parts, the visceral branch of the internal iliac artery and the parietal branch of internal iliac artery. So the visceral supplies blood in the urinary bladder, rectum, uterus, and the vagina, while the parietal supplies blood in the pelvis, lumbar, gluteal, proximal thigh muscles, and external genitalia. For the arteries of the lower limbs, we have the external iliac artery that becomes the femoral artery, then branches to become the popliteal artery, then lastly branches to become the anterior and posterior tibial artery. Then this anterior tibial artery becomes the dorsalis pedis artery, and the posterior tibial artery becomes the fibular or peroneal artery. Okay, so the blood vessels of systemic circulation, veins. So the oxygen for blood from tissues of body return to heart via the veins. So we have the two vena cava, the superior and inferior. So the superior returns blood from the head, neck, thorax, and upper limbs to the right atrium of the heart, while the inferior returns blood from the lower part, which is the abdomen, pelvis, and the lower limbs to the right atrium of the heart. So what are the veins of the head and neck? So we have the external jugular and the internal jugular vein. So these two veins can be found in the neck. So external drain head and neck into subclavian veins, while the internal jugular veins drain brain, face, and neck. So this internal jugular vein joins the subclavian veins on each side of the body to form the brachiocephalic veins. And these brachiocephalic veins join to form the superior vena cava. Then we also have the veins of the upper limbs, the brachial veins or the deep veins. So they empty into the axillary vein. So the superficial veins drain superficial structures of the upper limbs and then empty into the deep veins. So we have three veins in our brachial. So ito po yung veins na pinagkukuha na natin ng dugo during phlebotomy. So we have the cephalic vein that empties into the axillary vein, the basilic vein that becomes the axillary vein because it's interconnected, and we have the median cubital vein that connects the cephalic vein with basilic vein. So this is the site for drawing blood, the cubital fossa. So pinaka-safe na kuha na ng dugo in these three is the median cubital vein kasi among these three, yung ating median cubital vein is the most stable. and madaling ipalpate na vein. Although, pwede rin naman kumuha sa cephalic and basilic, yun nga lang, prone sila sa pamamaga. Yan, mabilis pumutok yung mga veins na yan. And ayaw naman natin saktan yung ating patient. Pero if bugbog na yung median cubital vein and kailangan talaga kuhanan ng dugo ang pasyente, so we have the two other veins, yon. Sila na yung next natin na vein na pwede nating kuhanan na invasive and mas less painful. Yan. Compared kung sa kamay tayo tutusok or sa vein sa may wrist. So what are the veins of the thorax? So there are three major veins return blood from thorax to the superior vena cava: the right and left brachiocephalic veins and the azygos vein. So for the azygos veins, there are two types: the anterior intercostal veins and the posterior intercostal veins. So the anterior drains anterior thoracic wall and empty into the internal thoracic veins, which empty into the brachiocephalic vein, while the posterior drain posterior thoracic wall and empty into the azygos vein on the right and the hemiazygos vein on the left. So the veins of the left empty into azygos vein, which empties into the superior vena cava. Yan. So pag kukuha kasi kayo ng dugo sa patient, so makita niyo yung cursor, this is the median cubital vein, then this is the basilic vein, and this is the cephalic vein. So ang palatandaan dyan, basilic vein near the body, then the cephalic away from the body. Yan. Then we also have veins of the abdomen and pelvis. So we have the ascending lumbar vein and the internal iliac vein. So the ascending lumbar veins drain posterior abdominal wall and empty into the azygos vein, while the internal iliac veins drain the pelvis and join the external iliac veins from the lower limb to form the common iliac veins, which combines to form the inferior vena cava. So this is the superior vena cava and this is the inferior vena cava. Then we also have the portal system and the hepatic portal system. So the portal system, vascular system that begins and ends with the capillary beds and has no pumping mechanism, while our hepatic portal system, when we say hepatic, so it means liver. So begins with capillaries in viscera and ends with the capillaries in the liver. So within the hepatic portal system, we have different types of vein. The splenic veins that carries blood from the spleen and the pancreas. We also have the superior and the inferior mesenteric vein. Then we have the splenic vein and superior mesenteric vein that join to form the hepatic portal vein. And the blood from the liver flows into the hepatic veins, which join the inferior vena cava. So the renal veins, so renal, which means kidney, so it drains the kidneys. Then we have the suprarenal veins, are the one that drains adrenal glands. Then testicular veins, male testes, and ovarian, female ovaries. Then veins of the lower limbs, we have the great and the small saphenous vein. So they join to form the popliteal vein that becomes the femoral vein, which empties into the external iliac vein. So yan. So physiology of the circulation. So blood pressure. So it measures the force blood exerts against blood vessels wall. So when we say systolic or systole, the maximum arterial blood pressure reached during ventricular systole, so contraction of the heart. Well, when we say diastolic pressure, minimum arterial blood pressure achieved during ventricular diastole or relaxation of the heart. So pag systolic, yun yung first sound na maririnig mo during auscultation. And the diastolic pressure is the last sound that you will hear during auscultation. So professionals use auscultatory method to determine the blood pressure. So pressure and resistance. So resistance to blood flow is related to diameter of the blood vessel. So the smaller the blood vessel diameter, the greater the resistance to flow. So the faster decrease in pressure as blood flows travel through it. So pulse pressure. So the pulse pressure difference between the systolic and diastolic pressure. So pulse pressure wave that travels along arteries when blood is ejected from the left ventricle into the aorta. Then we also have capillary exchange. So most exchange across capillary walls occurs by diffusion. So the blood pressure, capillary permeability, and osmosis affect movement of the fluids across the capillary walls and net movement of fluid from blood into tissues. So the fluid that gained in tissues is removed by the lymphatic system. So the edema is a results from the disruption of pressure across the capillary wall. So it causes swelling because of excessive accumulation of fluid. So namamaga. So kapag yung ibang matatanda, kung nakikita nyo, ito yung tinatawag natin na parang nagtutubig yung mga legs, yan. So merong edema. Kasi merong swelling kasi nag-accumulate yung fluid, hindi nag-flow ng maayos and hindi siya na-drain ng ating lymphatic system. Yan. So blood pressure stages. So ating normal, systolic pressure must be less than 120 and less than 80 for the diastolic. And for elevated, usually 120 to 129 mercury and less than 80. Then for high blood pressure stage 1, usually 130 ranging to 130 to 139 or 80 to 89. And stage 2, high blood pressure 140 or higher or 90 or higher in diastolic. And for hypertensive crisis, ito na yung kailangan na talagang ma-hospital, kailangan na immediate care. So higher than 180 and or higher than 120 for the diastolic pressure. So control the blood flow in the tissues. So the local control of blood flow, there is a periodic relaxation and contraction of the precapillary sphincters controlled by metabolic needs of the tissue. So when the sphincters relax, this increases the blood flow. And when the sphincters contract, this decreases the blood flow. So if the metabolic activity of a tissue increases often, additional capillaries gradually grow into the area. So it allows local blood flow to increase, matching the metabolic needs of the tissue. So nervous and hormonal control of the blood flow. So the nervous control of blood flow is carried out by a sympathetic division of the autonomic nervous system. So it innervates the blood vessels. And we also have the vasomotor center that continuously transmit a low frequency of EPs to sympathetic nerve fibers. These peripheral blood vessels are continually in a partially contracted state using a vasomotor tone. So if there will be an increase in vasomotor tone, it causes the vessels to further constrict, which increases the blood pressure. And if the vasomotor tone decreases, the blood vessels will dilate and decreases the blood pressure. Then we also have the sympathetic division that regulates the hormonal control of blood flow. So the release of the epinephrine and norepinephrine from the adrenal medulla causes constriction and reduces the blood flow. And in the skeletal or cardiac muscle, causes the blood vessels to dilate. which increases the blood flow. So this usually happens during fight or flight response. So tumataas, nagkakaroon ng adrenaline rush kasi. Yan. So, ang nangyayari, nag-i-increase din yung ating blood flow. Regulation of arterial pressure. So our AMBP or AMP, mean arterial blood pressure, is the average arterial blood pressure, and they are slightly less than average systolic and diastolic pressure because diastole lasts longer than the systole. So MAP changes in response to change in the heart rate, SVR or PR. So we also have the baroreceptor reflexes. So they are sensory receptors in the aortic arch and carotid sinuses, and they are very sensitive to stretching caused by increased blood pressure. So it regulates the blood pressure on a moment-to-moment basis. Then we have the chemoreceptor. It means chemical substances that causes reflex. So the carotid bodies, the small organs in the carotid bodies and aortic bodies near the carotid sinuses that detect changes in the blood, oxygen, carbon dioxide, and pH. Then we also have the hormonal mechanism. So the arterial blood pressure can be regulated through the adrenal medullary mechanism. So stimuli increases sympathetic stimulation to the adrenal medulla, and by which secretes the epinephrine and norepinephrine into the blood. So it increases the heart rate, stroke volume, and causes vasoconstriction. And in the skeletal and cardiac muscle, it causes the blood vessels to dilate. Then we also have the renin-angiotensin-aldosterone mechanism in the kidneys and the antidiuretic hormone mechanism, also known as the vasopressin. So the effects of the vasopressin can be blocked by alcohol because alcohol causes dehydration. Then the atrial natriuretic mechanism. So the AN hormone released from cells in the atrial wall of the heart when atrial blood pressure is increased. So this means that the blood pressure lowers because by increasing the rate of urine production. So frequent urination causes the blood pressure to be low. So what are the disease related to blood circulation? So we have two, the arteriosclerosis and the atherosclerosis. So when we say arteriosclerosis, makes arteries less elastic, and the atherosclerosis is a type of arteriosclerosis wherein there is deposition of plaques in the arterial wall. So factors that contributes to atherosclerosis is lack of exercise, smoking, obesity, high cholesterol and trans fat intake, and genetics. So ito yung atherosclerosis, ito yung nagkakaroon ng deposition ng taba or other substances sa artery wall. So nabablock, nagkakaroon ng blockage, so hindi na kapag flow ng maayos yung blood sa arteries natin. So pag merong atherosclerosis, mas mataas yung chance na magkaroon ng stroke or mas tumaas ang ating blood pressure and can also lead to heart attack. So that's the end of our discussion. I hope you learned something today. Thank you so much for listening.